How do you know that it's not something else going on? How do you know it's diverticulitis rather than some other inflammatory colon problem?
It's a great point. There's certainly other things that can happen in the lower left side or lower midline of the abdomen that can be confused for diverticulitis. In women, there could be gynecologic causes for pain, like a ruptured ovarian cyst. In anyone, you could have potentially a kidney stone that's passing that might produce pain on that side. The best way to figure it out is to see a doctor, get it checked if it's severe, and then potentially have an evaluation done, which might include something like a CAT scan. CAT scan would be the most appropriate and usual first diagnostic test that would be done in the case of suspected diverticulitis.
What would a CAT scan look like? You've got the colon is a tube that's there, and we've got outpouching from the inside of the tube toward the outside. What does the CT scan show you? A little grape there, or what?
So usually on CT scan, when somebody comes in with pain in the lower abdomen, the radiologist will focus in that space, and they'll look at those cross sections that show you the sigmoid colon, and you'll actually see some of those pockets coming off the colon wall in that general region. What the radiologist looks for in order to make a diagnosis of diverticulitis is typically a single pocket that has a very pronounced level of thickening around it. They call it stranding outside the colon, and that's usually correlating with some of the fatty tissue that's outside the colon that is now infected with some of those bacteria that leaked out of the colon.
So what is the patient telling you when they come in? They've got belly pain, you ask them where it is. Then what key questions do you ask them to determine in your mind, I think this is probably diverticulitis?
One of the things we ask them is if they know they've had a history of diverticulosis before, or if they've ever had a history of suspected diverticulitis in the past. That automatically increases the suspicion. We like to know if the pain syndrome they're having matches a previous history of the same thing. Does the story sound the same? Does it feel like it did the last time? That helps as well.
Is this a recurrent illness? I mean, will it come every other year or several times a year? Or what's the long-term history?
The natural history for most people is they'll have one episode, and if they go through some lifestyle modifications, they may never have another one again. That's the majority of cases. There are a few, 5 to 10% or so, that will develop recurrent episodes over the course of time. Some of them will actually have difficulty getting over any single episode and continue to have pain in the left lower abdomen that truly never completely goes away. It may decrease in intensity, and those patients may have a so-called smoldering diverticulitis, and they may need either prolonged antibiotics or even a surgical consultation.